Welcome, and thank you for taking the time to learn about your 2019 benefits. Enrollment has been extended to November 5th. This presentation will give you an update on the plans being offered in 2019, including what's new or changing. Additionally, we'll review how to enroll and resources that you can tap into if you need extra assistance understanding your choices. When you're ready to enroll, go to Benefit Focus, which will now remain open until 6 p.m. Eastern Time on November 5th. No changes are allowed after that point. Feel free to pause or rewind this presentation at any point to carefully review the slide. As we've prepared for the 2019 benefits enrollment, we've communicated a few times about how we're trying to manage the rising costs of benefits, in particular, medical coverage. Nationwide, medical costs continue to rise. No employer and no individual seem to be immune. At Purdue, our costs have increased by $30 million in the last 4 years alone, with Purdue covering all of that increase. While Purdue can continue to pick up the majority of the cost, we have to share more of these costs with you. You can help us manage healthcare costs by continuing to be a smart healthcare consumer, getting annual preventative care, which is free with our medical plans, as well as choosing generic prescriptions when possible, making financially wise decisions about where to seek care, and participating in wellness activities. Several causes have triggered the medical plan cost to increase. One of the most significant is the management of chronic diseases like diabetes, asthma, hypertension, high cholesterol, and depression. In fact, these conditions account for more than 62% of the money Purdue and employees spend on healthcare. While these are serious illnesses, many can be effectively managed, especially if they're identified early when they're less complex. And in some cases, preventative care and lifestyle choices could improve or even prevent them altogether. Our plans provide resources to help with these chronic conditions. For 2019, you'll notice a few changes. For starters, your medical premiums and out-of-pocket expenses will rise somewhat. Premiums for the university and employees are all higher due to a rising trend in healthcare costs. Additionally, there will be some increase to deductibles and out-of-pocket maximums. Despite these increases, our plans remain very competitive and employee costs remain below the national average. We'll share exact figures later in the presentation, and all of this information can be found in detail in your 2019 Benefits Enrollment Guide. We're offering some cost-saving changes too. In 2019, we will move to the CVS Value Formulary, which offers decreased costs for several prescription drugs that are now available as generics. And for all tiers of drugs, including specialty drugs, there will now be a maximum cost you can be charged when you have a prescription filled, enhancing the value of your prescription benefit. In mid-October, we announced a change to our spousal medical coverage policy. This change would have limited the ability of working spouses of Purdue employees to receive medical coverage through Purdue if they can get medical coverage from their own employer. After further consideration, we have decided not to institute this change to our policy at this time. We intend to review our policy in detail over the next 6 months and will consider outright elimination of the coverage or merely requiring a surcharge for continued coverage. This will give the employees and spouses who would be affected by the changes significantly more time to consider their options moving forward. In 2019, seeking care at the Center for Healthy Living on the West Lafayette campus is even more affordable. For non-preventative care, it's now just $25 for those covered by one of the HDHP plans, and remains only $10 for those on our PPO plan. Preventative care visits are free at the Center for Healthy Living as long as they are with any provider under Purdue Health Plans. Additionally, all wellness and employee assistance programs at the Center for Healthy Living are offered at no cost. Now let's review the university's process for tobacco certification status. If you or your spouse are currently certified as having completed an approved cessation program, then you will need to recertify your tobacco status in Benefit Focus. We will continue to offer the waiver of the additional tobacco user premium for those who complete an approved tobacco certification program with a completion date of January 1st or after. Completed program certificates submitted between January 1st and March 31st of 2019 will result in lower premiums for all of 2019. Completed certifications submitted after March 31st, 2019 will reduce premiums for the remainder of the plan year only. Keep in mind that if you don't recertify, you will default to tobacco user status, and the annual tobacco user additional premium will apply to both you and your spouse if applicable. When shopping for healthcare services, you will now have the option of using Anthem's Cost and Care Finder to compare prices specific to our plans and read reviews, all available online and through a mobile app. You'll log in using your current Anthem username and password. Visit anthem.com for more information. This new tool replaces Castlight. Purdue will continue to make contributions to HSAs, but they'll work differently in 2019. If you're covered by either the Purdue Health Plan Plus HSA 1 or the Purdue Health Plan Plus HSA 2, the university will deposit an HSA base contribution of $325 for employee-only coverage or $650 for employee plus one or more coverage. Additionally, if you are covered by one of our 3 health plans, you can earn a wellness incentive to be deposited to your HSA or wellness HRA of up to either $325 or $650, depending on what plan you chose and who is covered by your plan. Listen for more details on the wellness program coming up later in this presentation. Additionally, HSA Bank will replace PayFlex as the administrator for our HSAs, HRAs, and FSAs. More information will be provided to you in the following weeks. However, in early 2019, we will be transferring HSA funds for those who authorize from PayFlex to HSA Bank. As you enroll in Benefit Focus, you will be asked to determine if you want to consent and approve PayFlex to transfer your funds to HSA Bank. It is your choice to transfer your HSA funds or leave them with PayFlex. If you choose to leave them with PayFlex, you will become responsible for any fees that apply with PayFlex, including monthly maintenance fees, account closure fees, etc. We'll cover more about this in a few slides. Finally, there's a minor change regarding FSAs. Beginning in 2019, there will no longer be a grace period to submit claims for the limited purpose flexible spending accounts. Claims must be incurred by December 31st, 2019. This aligns all of our FSA and HRA plans to the same schedule where claims can be incurred up to December 31st. Then claims can be submitted through March 31st of the following year. Now moving on to dental and vision coverage. Dental plans remain the same, but premiums will be slightly higher in 2019 due to an increase in claims. Like the medical premiums, these are listed in your enrollment guide. Additionally, on the vision plan, eligibility for eye exams, lenses, and contacts have changed from 1 every 365 days to 1 per calendar year. This change gives you more flexibility over when you receive services during the year. Finally, the current legal plan has been enhanced with Life Stages identity management services. If you ever find yourself faced with identity theft worries, you can get help from a dedicated fraud specialist. This service is now available to Purdue employees through the Hyatt Legal Plan's voluntary benefit. Now, let's review our medical plans in more detail. You have a choice of 3 medical plans at Purdue. The first is the Purdue Health Plan, a PPO with a higher premium in exchange for lower deductible and out-of-pocket expenses. Next are the Purdue Health Plan Plus HSA 1 and Purdue Health Plan Plus HSA 2. Both are high-deductible health plans and have the option of health savings accounts for those who qualify. HSA 1 has a mid-range premium and out-of-pocket expenses, whereas HSA 2 offers a lower premium in exchange for higher out-of-pocket expenses. All 3 plans offer free preventative care when you see an in-network provider. Just as the university experiences changes with our benefits, you may also have changes in your family. So, it's a good idea every year to evaluate the plans, see how they compare, and determine which one best meets the needs of you and your family. Here you can see how each of our medical plans compare in terms of costs. This table shows you the amount the university will contribute to your HSA if you're on one of the HSA plans, the amount the university will contribute to your HSA or HRA if you participate in wellness activities, and also the deductible and coinsurance amounts, the total out-of-pocket maximums, and the fees when you seek care at the Center for Healthy Living. Prescription coverage varies depending on what plan you choose. This chart gives you a detailed description of the different types of prescription drugs and how each is covered under all 3 plans. You can also see the difference between ordering through retail or getting a 90-day supply through mail order. Please take a moment to review the coverages. You can find the 2019 summary of benefits and coverage for each of Purdue's medical plans, as well as information on other benefit plans at purdue.edu/benefits enrollment. A paper copy is available upon request by calling 765-494-2222 or emailing hr@purdue.edu. Lab coverages and tiers will remain the same in 2019. All Tier 1 labs, including labs from the Center for Healthy Living and the Purdue Student Health Center, known as PUSH, are no cost to employees on the Purdue Health Plan. All preventative labs in Tier 1 and Tier 2 are covered at 100% on all 3 health plans. Tier 1 labs continues to offer the best savings. The Purdue Health Plan will cover non-preventative labs at 100% as long as you use a Tier 1 lab. If you use Tier 2 labs, you will need to meet your plan deductible. Then pay 20% for Tier 2 labs or 40% for Tier 3 labs. Under the HSA 1 or HSA 2 plans, your non-preventative lab costs will apply towards your deductible. Then they will be either 20% or 25% coinsurance once your deductible is met for the Tier 1 and Tier 2 labs. If you're using Tier 3 labs under the HSA plans, you would pay 40% or 45% coinsurance once the deductible is met. For an updated listing of lab locations, visit the benefits website. Premiums for the plans listed here reflect an increase from 2018 to 2019. They vary depending on which plan you choose, who you cover, and whether your annual salary is less than $44,000 or equal to or more than $44,000. The medical premium tier is based on the employee's actual annual salary. Next, we see how premiums are adjusted for those with salaries over $44,000. Premiums adjust accordingly at the same time an employee's salary crosses above or below the $44,000 annual salary tier. Also, note that these rates do not include the tobacco user additional premium of $500 or $1,000. Our Healthy Boiler Wellness Program is back again for 2019. Purdue will offer incentives for eligible employees and covered spouses who get an annual physical and record their biometrics. We also encourage you to complete the online education modules and the many other resources offered through the Healthy Boiler portal. This chart shows how much you're eligible for based on your plan and who is covered by your plan. Payments are made on a quarterly basis through your health savings account or health reimbursement account. This is a great way to help pay for some of your out-of-pocket medical expenses. There are several important things you should keep in mind regarding the Healthy Boiler program. You must complete your annual physical with biometric screening and upload it into the portal to receive your incentive. You should be aware that there is much more to the Healthy Boiler portal than tracking your wellness incentives. You can set personal goals and track your progress year over year. Learn tips and tricks on eating better, getting more active, and making healthy choices. Engage in competitions and campus-sponsored programs and events. Watch cooking demos and print off grocery lists and recipes. And calculate your BMI, calories burned, and how much time it will take to reach your goal weight. Our goal at Purdue is to create a healthy community, and providing this portal is one of the many steps we're taking to get us there. Open enrollment has been extended to November 5th at 6 p.m. Eastern Time. Once you're ready to enroll, you'll sign in to Benefit Focus through the One Campus portal at one.purdue.edu. If you don't know your username or password, you can call one of the numbers on the screen. This year, you'll notice Boiler Key, Purdue's new two-factor authentication for enhanced security. It will be required for logging into the Open Enrollment portal beginning October 30th, 2018. Employees will have to use the Boiler Key service for other system accesses as well. Don't wait. Employees are encouraged to set up their Boiler Key now. Go online for further instructions. Once you log into Benefit Focus, you'll see your personalized welcome page, shown here. From the welcome page, select the Gold to enroll, make a change, and view your benefits Click Here box in the upper right-hand corner. Now, you'll see the Manage Your Benefits page. Choose the Gold box to get started with your enrollment selections. First, you will be asked to add, verify, or edit your dependent information. As you review your dependents, be sure the Social Security numbers are listed and accurate for each of your dependents. While you will be able to enroll without this information, it's important that you complete the Social Security number info, as Purdue is required to submit this information on your behalf to Anthem. Once you log into Benefit Focus, one of the items you'll be asked to respond to is the Tobacco User Certification. This slide shows the response options you'll have to complete for you and your spouse if covered on a Purdue medical plan. Remember, rates for the medical plans, voluntary term life insurance, critical illness, and universal life insurance all have premiums based on tobacco user status. Purdue is required to provide you access to several legal notices that shows compliance with various legal requirements, including the HIPAA Notice of Privacy Practices. On this screen, you will indicate if you want to have access online only to these notices or if you'd like a paper copy mailed to your home after enrollment closes. Although we've delayed instituting the new limited spouse rule, you will still need to respond to this question in Benefit Focus and answer based on which statement applies to you. We mentioned that you will be asked to document if you want to give consent for PayFlex to transfer your HSA funds. This slide shows what you will see in Benefit Focus. The actual transfer of funds will not take place until March of 2019, and more specific details and the timeline will be available in the next few weeks. Once you have made your benefit selections for 2019, you'll need to finish your enrollment by selecting the Complete Enrollment button. At this point, you'll see boxes that allow you to review the choices you made. At the bottom right-hand corner, you can select a benefit summary document and save it for later and print if you choose. You're done enrolling. If you need to make changes, you have until the end of open enrollment to edit and resubmit your elections. If you need to submit documents, such as those required to add new dependents, you can do that in Benefit Focus from the Document Center. From the Manage Your Benefits page, select Document Center on the left-hand side. Once you see the Document Center, select Add Document. You will then be prompted to upload a file from your saved documents. Select Choose File and provide the document name, category, and a description if needed. Then select Save. From here, you will be able to see that your document has uploaded correctly. Then select Save to return to the Manage Your Benefits page. To help you understand your benefit choices, we host live presentations and walk-in labs, as well as offer one-on-one appointments with our Anthem representatives. You can also visit with representatives from CVS and HSA Bank during their walk-in hours. All these in-person resources allow you to discuss your options and get questions answered. Plus, we hold special sessions or walk-in labs for those who English is a second language. These are happening at all our campuses. You can find a complete list of dates and locations on our benefits website or in the 2019 Benefits Enrollment Guide. You can also visit our website to review information and watch recorded presentations and videos on a variety of topics. Thank you for taking time to view this presentation. For any other benefits or open enrollment related questions, you may contact HR at 765-494-2222 or via email at hr@purdue.edu. If you have sensitive information that you're going to include in your email, please go to purdue.edu/HR help and log in with your career account to send a secure message directly to HR. Best wishes for a healthy 2019.